Hi, in today's video we're going to talk about bleeding. Bloodletting or bleeding techniques are a very useful tool within acupuncture and traditional Chinese medicine that I feel that a lot of professionals are not fully using to their advantage. And I think that the reason that most people don't use these techniques is because they're not properly taught in most courses of TCM and of acupuncture. I know that that happened to me, at least. When I started working, I almost never used these techniques because I felt first that they were very painful for the patient and second that they were not that effective. I mean, I saw some results, but nothing spectacular. In contrast, today, after learning a better way of using these techniques, I use them on almost every patient, especially in the beginning of the treatment. These techniques are fantastic to treat anything related to stagnation, to get quick results when treating pain. They have a wide range of applications and they're very good to help your practice. If you'd like to learn more about the techniques that I talk about in my videos, check out the links for the courses I have available. I have balanced method courses, both in Portuguese and in English. Check them out. In this video, I'm going to try to show you a better way of using bloodletting and maybe influence you to use it more on your patients and improve your results. One of the main problems that most people have with bloodletting techniques is that they feel they're too painful for the patient. If you're one of those people, don't turn off the video because later on I will show you a better technique that will be less painful for the patients. In fact, most patients say that when I use this technique, it's less painful than a regular acupuncture needle. But another problem that most people have with bleeding techniques is that they feel that they're not that effective. And one of the things that changed my whole approach when using bleeding techniques was the bloodletting book by Dean Musher. I don't know if you know it. You can see a picture of the cover of the book here. It's maybe the best book ever written about bloodletting techniques in Chinese medicine. And one important thing that I learned from it was that in most cases we should not bleed the actual location of the point, as I learned when I was studying in university, but that you should look for spidery veins around the area of the point. Those very thin, very superficial veins that usually are dark colored or red will get you better results, you get more bleeding, and you don't need to hurt the patient as much to do it. So what I will do generally is, if I want to bleed something in the area of lung 5, for instance, instead of going to the actual classical location of lung 5, I will look all around the area of the point for this superficial vein. Something like this image you can see here, where you have a very thin, very superficial vein around the area of the point. And that's where I will bleed. And you can apply this technique either using the classical indications of the points, so I can bleed the area of lung 5 to treat chronic shoulder problems, or I can bleed the area of bladder 40 to treat lower back pain, which is in fact a fantastic approach if you do it properly. But you can also use the ideas of the balance method, especially the imaging techniques, to apply this technique. But in my opinion, you should not do the full balance method way, where you select an affected channel and then you select a balanced channel. But in this case, when I use bleeding, I always use the affected channel. So if I want to treat something that is along the stomach channel, for instance, facial paralysis, I will use an image, but I will use the stomach channel on the affected side. So if I have, for instance, facial paralysis in the eye on the right side, I may use, or I may look for spider veins around the area of stomach 43 to 44 on the foot on the same side. Because when we're bleeding, we're opening the channel, we're taking the pathogenic factors out of the channel. So for me, it's important to use the actual channel that's affected. I will avoid doing local bleeding in most places. I will use the imaging ideas, but I will use the actual affected channel. As I told you in the beginning, I think that most people avoid bloodletting techniques because they learn techniques that are very painful when they're in university. That's what happened to me. What I learned was either using the 7-point hammer, which is very painful, or using the leopard spot technique, where we puncture the actual acupuncture point 5, 6, 7 times to get some bleeding, which is very painful for the patient. So let's see the technique that I use now, that I actually learned from Yang Wei-Che, one of Master Tong's direct disciples. So what you do here is, as you can see, you locate the spider vein. This is the area of bladder 40. It was to treat lower back pain. I use 19 or 20 gauge needles for this. And you just find the point, and with a very swift move, you can get this result. As you can see, you have immediate bleeding, and it's almost painless for the patient. Now, something very important. If you don't have the proper training to do bloodletting techniques, if you're not a trained acupuncturist, if you're not a trained TCM specialist, go find proper training. This technique can be more harmful than even acupuncture if not used properly, and you should not learn it from a YouTube video. You should learn it in the proper way before you try to apply it to a patient. As I told you, this technique is very, very good, and it will surely improve your results if you start applying bloodletting to your patients. One classical application to finish this video: lower back pain using bladder 40. If you tried it with a classical approach where you bleed the actual point, which generally doesn't have a vein there, probably you were underwhelmed by the results. But if you start using it as I told you now, so you look for the superficial vein around the area of the point and you bleed there, I guarantee you that it will improve your results. In most cases, when you have that very acute low back pain, for instance, the patient was tying his shoelace and then his back locks up, all the muscles seize up, and the patient calls you saying, "Oh, I can't even get out of bed, it's impossible to stand up." You get there, you locate the vein. You can do both sides. Typically what I do is, if there's one side more painful than the other, I will choose that side. I will look for a dark vein. I will bleed that area. And in most cases, you have an instant improvement. And in many cases, that's all you need to solve their crisis and get them back on their feet. So I really encourage you to study more about bloodletting and start incorporating it as much as you can in your treatment, because it is a very, very, very useful tool to have in your toolkit. Thank you so much for watching this video. If you liked it, don't forget to like and subscribe to the channel, and I will see you next time.